for that. So that's why you have little charts like this. You're going to have to interpret your zone of inhibition, because some antibiotics are going to naturally make a bigger zone of inhibition because they diffuse more readily. Other antibiotics are naturally going to make a smaller zone of inhibition because they diffuse slowly. But it also has to be used, that zone of inhibition, to decide if the bacteria are sensitive or resistant to the antibiotic. So that's why you have to compare it to the chart, because it accounts for differences in the diffusibility of the antibiotics. So if you didn't print this out for yourself, here's a copy for you. You're going to fill in this little table. What you're going to do is get out your Petri plates, hold them up against the tabletop. You don't have to open them, just hold them bottom up on the tabletop. And then you're going to use your little centimeter ruler, but you're going to measure in millimeters.
That's okay.
It was already cracked once.
Yeah, I know.
You're going to measure the size of the zone of inhibition. So, if you don't know that this is a zone of inhibition, you might miss that question on your lab practical. But if you know that that clear area around the disc where the bacteria are inhibited from growing is called the zone of inhibition, you'll probably get that question right. See how easy that was? Okay. Now, so you're going to put your Petri plate upside down. This is my plate for E. coli, so it's covered with E. coli, which is essentially a bacterial lawn. The entire thing's covered with E. coli. And then I dispense my antibiotic discs onto it. And each disc is labeled with the antibiotic. I just didn't label those. And then we're going to measure the zone of inhibition all the way across. So you're going to use your little rulers that should still be at your table. And you're going to hold it up against your plate. And you're going to measure all the way across the zone of inhibition, the complete diameter of the zone of inhibition. And you're going to record that diameter under the proper antibiotic on your chart. So for AM10, I measured, and I got 15 millimeters is the diameter of that zone of inhibition. Then I have to go to the chart and look for ampicillin. It's right at the top, and it says resistant is 11 millimeters or less than 11 millimeters. It would be considered resistant. So there's a zone of inhibition, but it's not big enough to be considered, for the bacteria to be considered sensitive to it. Sensitive, the zone would have to be greater 14 millimeters or greater than 14 millimeters in order for us to consider the bacteria sensitive. So since my zone of inhibition is 15 and 14 is what's considered sensitive, my bacteria, E. coli, is sensitive to ampicillin. Let's do the penicillin one. Penicillin has bacteria growing right up onto the disc. From the underside of the plate, you wouldn't see the bacteria growing on the disc, but if you flip it over, you'll see them maybe growing right over the disc. So the zone of inhibition is 0. They're not inhibited at all. They're completely resistant to penicillin. Okay? Sometimes, remember, we showed synergistic effects in their PowerPoints, where you have one zone of inhibition here and another zone of inhibition here, perhaps. And then in between, it's clear also, because the effect of that enhances the effect of that, and so it even gets the ones in the middle. Outside of the zone of inhibition, they enhance each other's effect. That would be synergistic effects. You might get something like that. Sometimes you'll get a fuzzy zone of inhibition. If it's fuzzy, don't measure it. Only measure where it's clear, because if it's fuzzy, it's not completely inhibiting the bacteria. So that wouldn't be a good choice of an antibiotic. We also talked about Kirby-Bauer method. Tells you something about the antibiotics for that particular infection. E. coli, ampicillin might work, penicillin's definitely not going to work. But that's not where it ends. We also have to do other tests, like a minimum inhibitory concentration test. Because maybe I could have picked this drug for my patient, but maybe it's actually more sensitive to this drug than it is to that drug. So I can give this drug at a low dose, and that one, in order to be effective, I'd have to give a really high dose. I don't want to give my patient a high dose of a less effective drug when I can give them a smaller dose of a more effective drug. And it depends on what your objective is too. Or am I treating a mixed infection in my patient? Or am I treating a particular single kind of bacteria? So that might also influence my choice of antibiotic. Also, the route of administration. Is the drug going to be active when it gets to the site of infection, or does it get broken down physiologically along the way? Do I have to give intramuscular, or maybe an oral, maybe a topical? So there's different routes of administration. And you also have to consider contraindications. My patient's already on this drug. If I give him this drug, it's going to cause his kidneys to shut down because it's too much. Or maybe this drug renders this other drug inactive, so I can't give those two drugs together. Or maybe I don't want to give this drug to my patient because he's a child and it's going to give him gray teeth when he grows up or something like that. So there's other factors to consider, not just factors about the bacteria, but also factors about the patient and factors about the drug itself. So all of that has to be considered. So this is just the beginning. It's not, we don't use Kirby-Bauer to definitively pick the antibiotic we're going to put the patient on. What happens if I have the zone of inhibition looking good, but then I notice there's actually a little colony growing inside the zone of inhibition? What does that mean? I got a resistant strain developing, right? So if I had already started my patient on this drug, and then I realize I got a resistant strain developing, now I'm kind of growing a superbug in my patient. I've killed off all the weak ones, and now the resistant ones are what's going to grow in my patient. So usually what they'll do is add another antibiotic. They don't want to withdraw the first one because it's actually working for most of the infection. But now I got to find another drug that will get these resistant ones. So there's different things they can do with a Kirby-Bauer test, but it's not the end all for selecting an antibiotic. There's other things that have to be considered. So after you measure your zones of inhibition and decide if the bacteria are sensitive or resistant to the particular antibiotics, we'll put them up on the chart on the board and we'll discuss them. And then you also have your disinfectant plates, your disinfectant test tubes to look at where you had the toothpick soaked in E. coli. Those you can save. We'll check them again next week. Sometimes the effect of the disinfectant doesn't really show up until like a week later. And then your antiseptic dishes, you can just look and see what happened if your paper disc is soaked in an antiseptic. Did you get a zone of inhibition? And then when you're done with those, you can probably pitch them in the biohazard box. Okay, measure, we'll do that. And then if you have any questions, we can do that. Tomorrow we have to leave by 4:50 because I have an appointment. So we can review a little bit today if you want.
Yeah. Yeah.